Diabetes is a very common condition. More than 25 million Americans, roughly 8% of the U.S. population, have diabetes.
Diabetes is a very common condition. More than 25 million Americans, roughly 8% of the U.S. population, have diabetes. Most of these people have type 2 diabetes. Type 1 diabetes, conversely, accounts for only 5% of people diagnosed with diabetes. So what is type 1 diabetes and how is it different from type 2? Well, let's begin with a basic overview of diabetes in general. Diabetes is a metabolic disorder. That means it affects the way your body digests the foods you eat. Specifically, if you have diabetes, your body has trouble processing glucose or sugar. So instead of changing glucose to energy, the sugar builds up in your bloodstream and is excreted when you urinate. If you have type 1 diabetes, it means the reason you have trouble converting glucose to energy is that your body produces little or none of a hormone called insulin. Your body needs insulin to live, and if you do not produce your own, you need to receive it through regular medical injections. Type 1 diabetes usually begins in children or young adults and has sometimes been called juvenile diabetes. Type 1 diabetes can start at any age, but 7 out of 10 people with this disease are diagnosed before the age of 30. Symptoms of type 1 diabetes often start suddenly, though the disease may begin long before the first symptoms appear. Symptoms include constant hunger and thirst, and frequent urination, and weight loss, blurred vision, and extreme tiredness. You may suffer from tingling or pain in your hands or feet. If a person with type 1 diabetes does not receive treatment, he or she may lapse into a coma or die. Type 1 diabetes is an autoimmune disease. More specifically, it's caused by your own immune system attacking the cells in your pancreas that normally produce insulin. Scientists and researchers have not yet determined what causes your immune system to attack these cells. If you suffer from type 1 diabetes, you will need daily insulin injections. You'll also need to test your blood glucose levels several times a day and to watch what you eat to keep your glucose in balance. Now, there is no known cure for diabetes, but with proper treatment, you can live a long and healthy life.